Hi, I'm Kettering Mayor Don Patterson.
Hello, I'm Lori Sims Parks, President of the Kettering Board of Education.
The opioid and heroin epidemic isn't just something we hear about happening around the country. It's here, it's real. It's impacting our region, our city, and our neighborhoods.
The key to addressing this crisis is educating the Kettering community about both the realities and the impact of this epidemic on all ages throughout our community.
We want you to know that the City of Kettering and the Kettering City Schools are committed to leading the way, and this video is one way we are providing the information about this epidemic for our community.
At the end of this program, we will share valuable tips and resources about how you can join us in the fight against the opioid and heroin epidemic. Thank you.
It's startling when you're talking to someone that had their whole life ahead of them and everything was on track, and now you're sitting in a jail cell with them and you want to know where things went wrong.
They never wanted to end up here. I don't think anyone in their right mind would want to be a heroin addict. But at the end of the day, they had no idea what that addiction was going to do to them, where it was going to lead them, and the effects it was going to have on their life.
When someone experiments with an opiate, there's no experimenting it. It's addiction. So it's, you got one shot at it.
That drug literally destroyed everything good within you. It was so much more important to you than me.
Somebody approached me and said, well, here, try this, and it was Oxycontin 80.
That's how this problem always starts.
All I wanted to do, if it had been in front of my face, is do it.
It just turned me into a monster.
I never thought any of this would ever happen to me.
I'm a criminal, I'm an addict. That's how everybody will always perceive me.
You can be the smartest person in the world. The minute that chemical hits your bloodstream, you lose control of what it does in your body. You can't control it. Nobody can control it.
And I asked them, of all the drugs they've ever tried, what's the most addictive drug? And without a doubt, it's oxycodone.
There's absolutely no difference between a heroin addict and a pill addict.
Every one of those needle users will tell you they couldn't get the high anymore doing it the way they were doing.
Heroin became the love of my life. I put heroin before my family. I put heroin before my children.
Just get me a little so I can stop.
I wasn't using to get high, I was using to stay well.
Your whole day revolves around it. You go to sleep doing it, you wake up doing it.
You're willing to do anything to get that next high.
I wouldn't wish that feeling upon my worst enemy.
You are who you hang out with, that is for sure.
I had a good life. I didn't need to do it, and I just couldn't stop.
I had maggots in my leg.
You'll do anything to make it stop.
You're still chasing that first high.
I couldn't even function without 40 pills a day.
It'll take you to hell and back, and if you're lucky, you'll make it back.
He sold me heroin, the same heroin that just killed me.
Her sister found her with a needle in her arm.
You can't go back and say I'm sorry or set a better example.
As much as I wanted to quit, I was too scared to ask for help.
It will get you.
Because I know it will kill me.
And my little girl is on the floor dead.
This is the largest drug epidemic that we have ever faced.
When we reference the opiate crisis, it's more than an opiate crisis for not only Ohio, but for the Montgomery County area. And if I just deal with numbers that have occurred in the last few years, in 2014, within Montgomery County, we had about 264 accidental drug overdoses. That year in 2014, for instance, City of Kettering had 8 deaths. In 2016, Kettering had 18 deaths. Montgomery County had 249. Unfortunately, as we sit here today, Kettering has already had 18 overdose deaths for 2017, Montgomery County is already over 300 deaths, whereby last year we experienced about 350 overall deaths. We are at a pace in Montgomery County to exceed 800 accidental drug overdoses in 2017. And it's tearing apart the community in the sense that it's not just the folks that die, it's the families associated with it, it's grandmas raising the kids. And we back up and we try to look at what's causing all of this. And the availability of heroin on the street was very inexpensive. We saw a change then from the inexpensive heroin to now the first generation almost 3 years ago of fentanyl. And fentanyl is a pain medication that is administered via patch by a doctor for long-term comfort. The next generation became the carfentanil, or the animal tranquilizer, and we know that is supposed to be somewhere between 20 to 100 times more potent than fentanyl, which is X amount more potent than morphine. So all of a sudden we have a community now that is seeking greater degrees of drugs for that ultimate high. Unfortunately, a significant number of them are dying from it because there is no quality control on the street. And if you look at carfentanil and say, well, how much of that do I need to die? And we take a salt shaker and say a couple of grains of salt, that size of carfentanil will kill you. So the death is pretty instant. When we look at our cross-section of the community, the vast majority of deaths are in the Caucasian male population. In the last few years, we've seen a little shift where there's an increase in female Caucasian for the deaths. But it's primarily throughout our community. Kettering is no different than Dayton, from Centerville, from any other community. The deaths are everywhere. And to sit back and think we may have 800 accidental deaths in Montgomery County in 2017, that should scare everybody. It's a community issue. It's something, as we're doing today, we're talking about it. We're not hiding the fact. We're trying to proactively come out and say, the numbers are staggering and we need to do something as a community.
My name is Andrea White. I'm the Clerk of Courts at Kettering Municipal Court, and I'm also the Vice Chair of the South Suburban Coalition, which is a group of 8 communities that are focused on helping to reduce teen alcohol and other drug use. The goal is to help our teens understand that there's lots of positive reasons to stay substance-free, and the vast majority of our youth are not using alcohol and other drugs to build for their futures.
I'm Ann Stevens. I'm with Montgomery County Alcohol, Drug Addiction, and Mental Health Services, and we are the ones who help with the planning and funding for any kind of substance use and mental health issues we have in Montgomery County. Right now, of course, it's the heroin epidemic.
You know, in a very short period of time, the average profile of somebody dying of an overdose went from a 40 to 50-year-old white male to a 30 to 45-year-old white male, and it's continuing to drop. And those are overdose deaths. Now we're seeing more females. We're seeing a stronger use of drugs among young people. And so what that's going to do is create a pipeline, unfortunately, of that 18 to 30-year-old population that are getting addicted to drugs, addicted to prescription pills, and then because of the highly addictive nature of those, they can not just satisfy their addiction with that, and they're moving on to heroin. So in essence, because we've seen this dramatic increase of younger people using prescription pills, younger people starting to have overdose experiences, starting to seek treatment, as well as being tested positive for opioids when they get arrested in the juvenile justice system. These are all trends that we're alarmed about. We should all be alarmed about, because the profile of who's using and who's dying from heroin and prescription pills has dramatically changed.
We're seeing an increase in overdoses of all kinds. We are seeing people that are requiring a lot of Narcan, and sometimes when they're getting it, they're not even getting resuscitated fully, because there's quite a mix of drugs that are coming together at this point. Not only do we see the overdoses, but we see a lot of the infectious disease consequences. We are talking about an addiction which affects good people from good families who attended good schools, and they're dying. And we need to work as hard as we can as a community to fix that, because it is for the good of our community. But remember, these aren't bad people. They didn't start that way. They didn't make this choice willingly. These are good people coming from good families and starting in good schools. And anything we can do to save them is what we need to do.
Hi, my name is Corey Miller, and unfortunately I'm here today because I have a very personal connection to the opiate epidemic that is taking the country by storm. I'm a member of the Kettering community. I grew up here, went to Kettering schools, and my family just over a year ago was affected by the terrible thing that's taking place right here in our own community when we lost my own cousin, who's only a month older than me. And so it was a cousin who was very close to me, who we grew up together. Every family event we were together, and even into adulthood, saw each other quite a bit. My message is really, when you think of this problem, is to think of it as a problem that is affecting everyone, whether it's the person who passes away or the family that is left dealing with what happened. And also, this issue is not something that you can stereotype people and put them into a category. My cousin graduated from Carroll High School, was a middle-class, white, 29-year-old who owned his own house, had a good job, was a loving family member, and it took him.
Well, Scott, I certainly think it's important that we're having this discussion today, because the heroin epidemic, the opioid crisis, is not just something that's in a pocket of our neighborhood here in Kettering, but it's in all neighborhoods and the entire community. And certainly, in most cases, it's attaching to every family. There is something or someone in every family that may be touched by this crisis. So as a community, I think it's great that we're talking about this. And why don't you tell us a little bit about what's going on at the schools?
Absolutely. Thanks, Mark. Yeah, about 18 months ago, we started on this journey. We went down and had a meeting that was presented by Attorney General Mike DeWine, and he brought to our attention that day of what I don't think any of us were really prepared for, which was this epidemic that has truly hit our communities. And it has impacted our communities. It has impacted our students. It has impacted our parents. It has impacted our first responders, and it's put a drain on the resources of both the city and the schools. But yet, I think we've prioritized and tried to find a way that we can go about meeting the needs of our families in Kettering and all of our schools that are in Kettering. And it's led to us really taking a look at safety and security.
It does indeed. And what's fortunate for our community is it starts not only with the administrators and the staff of both organizations, but the elected officials of both organizations as well. So the impact that we're seeing from the public safety side really hammers home the fact that this is not just a crime situation. It's an epidemic. It's an addiction. And I think our police department is working, with other agencies so that we can get help for the folks. When we show up at a house and we have to administer Narcan, it's not about making an arrest. It's about trying to get help for the individuals who need the help and creating a network of resources within our community as well as within this region so that folks can get assistance with this, because certainly it's going to take, they say it takes a village. Well, it's certainly going to take our entire community, not just the city and the schools, but also all of the resource providers that are in our community to get educated on the issue.
One of the things for us that's been really interesting is in talking to students, and they're really the ones to really ask. Basically, they're saying, heroin isn't really a problem for me, but I can tell you that my cousin or my parents or other relatives are using it. The big problem for us is that gateway drug, which is marijuana and alcohol. And that is a problem. And we realize that we have to address that too. So out of this major issue, which has been the opioid heroin issue, we're still trying to address that too. And it's an education piece for us. That's a very powerful tool. And I think it can really make a difference.
Hi, I'm Chip Protzman, Chief of Police with the Kettering Police Department.
Hi, I'm Tom Butts,
Kettering's fire chief.
We're here to talk to you today about the heroin issue that we're having, just not in the Montgomery County area or across the country, but the issue it's causing for the city of Kettering as well.
Well, I would like to discuss how the opioid and heroin overdose issues have affected the Kettering Fire Department. It has been a dramatic effect to our department in the amount of run numbers that have increased and our usages of Narcan, or the naloxone. In the past years, we have seen a gradual increase in overdoses, and then this year has been astronomical. To give you an example, last year our department administered 103 dosages of Narcan for overdose patients. This year alone, just from January to May 15th, we have already used 177 dosages of Narcan. That alone speaks volumes of the issue that is resulting in our city. It is also happening throughout our entire community. We cannot pinpoint it to one area of our city. It is spread throughout the entire region. These typical emergencies, we receive a 911 call on an unconscious patient or unconscious patients, because we are starting to see now multiple usages and multiple patients on one scene at a time. Our crews will arrive. Most patients are in an unconscious and barely breathing or not breathing state. We will treat those patients. If the revival is successful, most likely the patient is revived on scene. They will become alert and they will refuse any more treatment from us, from the Kettering Fire Department. So we are not taking a lot of these patients to the hospital. If the patient does get removed to the hospital, 9 times out of 10, these patients are not even treated at the hospital because they will walk out before the hospital has even an opportunity to treat the patients. So we are seeing that trend throughout our area and throughout the region as well. In years past, multiple alarms would come in and it would be mostly fire and medical, but we would be treating mostly our citizens for falls, injuries, and alike. Today's, the typical calls from our crews that they see are the overdose scenarios. So it is not unusual for our crews to answer these overdose calls day in and day out, and multiple alarms during the daytime to treat the overdose symptoms.
The Kettering Police Department has seen a massive increase in drug overdoses and drug arrest, and a lot of that stems from the heroin epidemic that we are dealing with. We have done several things to try to combat this. We split it 2 ways. One is the law enforcement perspective and the other is treatment perspective. So with the law enforcement perspective, we have put a number of people in our vice unit. 2 years ago we had 1 officer who was working there. We now have 4 officers and a supervisor who are in that unit. They do undercover work. They follow up on drug complaints from our citizens, and overall just keep a watch of what's going on with the heroin epidemic and other drug issues that we are having. We've also added an additional canine to our unit. We now have 3 canines for the Kettering Police Department. Those dogs are cross-trained. One of the trainings that they have is drug indicator dogs. So if someone is stopped in a vehicle or we're in a house and we feel that there are narcotics, particularly that people are hiding, we'll bring the dogs in to search, and when they indicate, the officers will then look closer. A lot of people believe that we need a warrant to search cars. That's not the case. If a canine would hit or indicate on a vehicle, officers then have the right to go in and search that vehicle. Another thing that we are doing on the enforcement side is we are now training our officers better on drug interdictions, and they're looking for that closer. So officers working the street are now paying attention to where the drugs are coming from, those who they think are transporting them in or using them, and are using traffic stops and other methods to try to combat that. On the treatment side, we understand that you just can't get away from this problem by arresting people. We also want to be there to help. So a few things that we are doing, we are working with some of the social services agencies. One of the things that we're trying to get going is a front door program, and that is if someone comes to the police department or to a police officer and lets them know that they have a drug problem and they want help, that we will be able to get them to a treatment facility right away, and that person will be able to walk in the door and start their program right away instead of having to wait. We have also written a grant for a mental health coordinator. This person will be responsible for building a better relationship with the police department and those with mental health. And as we all know, and as research indicates, that mental health and drug use sometimes go hand in hand, so we believe that that will be beneficial to us as well. And just overall for the schools, we've added a school resource officer for Fairmont High School. We now have 3 officers who are SROs, and they do programs in the schools. The biggest one is the Red Ribbon program for the middle schools, where officers educate those students on the hazards of drug use, what to look for, how to say no, and how to get help for themselves or others if they need to.
I'm Mitch Robbins, Assistant Chief of the Kettering Fire Department, currently assigned in the role of operations. I'm here to talk to you about the heroin epidemic and how it has hit the region. This has caused the Kettering Fire Department to increase our training and awareness in fentanyl and carfentanil and heroin type incidents. The crews have to use their training and awareness to understand that any type of alarm, even for an unconscious, unknown, or unknown type dispatch, could possibly be a heroin overdose or an opioid overdose.
Hi, I'm Dan Von Handorf, the Director of Student Services from Kettering City Schools.
Matthew Barnes, I'm a police officer here for Kettering Police Department, Community Relations Officer, and my main job is to act as a school resource officer in our schools.
Chasing the Dragon is a documentary that we set up with the high school last summer. One of our school resource officers, Officer Drayton, and one of our school counselors, and I went down to the FBI's educational outreach program. They had a showing for all the school districts in Southwest Ohio and offered that program as something that school districts could do to help inform the student population on the dangers of opiates and prescription drugs. We took them up on that offer. This year, all of our students watched that documentary, and we spent 4 days in advisory, which is like homeroom, talking about what they witnessed there. That culminated in about an hour-long panel discussion with experts. Our kids submitted questions to them, and those experts answered them for students. It was a great event. I think our kids got a lot out of it. Our teachers got a lot out of it, but it was a great way to share knowledge on this growing crisis in our community. Our health classes touch on that. A lot of what they do is through current events, and so one example that the high school gave, every 9th grader had to do a current event article on opiates or on overdoses or on heroin, and they discussed those in their classroom. But a big part of that is Red Ribbon Week, and we lean on our school resource officers who do just a fantastic job talking to our kids. And so I'd like to turn it over to Officer Barnes to talk a little bit about the middle school and Red Ribbon Week and what you do there.
Okay. A big undertaking for us in the fall of every school year is Red Ribbon Week. It's a nationwide drug initiative program that we have expanded, and every year it seems to grow. This year what we've done with our drug program is coordinate that educational component through Red Ribbon Week to reach every middle school kid in the district. Our hope is that every kid gets it when they enter the middle school, and then just we touch upon it as they continue to graduate into the high school program. So by the time they hit the high school, they should have a pretty good knowledge of how people get addicted to drugs, why they get addicted to drugs, what that looks like, what the ramifications and consequences are, how to recognize and get help for people that might be dealing with something like that, which, as we can all agree, has become more prevalent.
And in addition to our middle schools, the SROs also present at Alter High School as well, similar information. And then for the first time this year, one of our counselors had asked the school resource officers to go in and talk to 5th graders.
At the elementary level, we presented some basic information pertaining to gateway drugs, drugs that are unfortunately becoming more common, but certainly which can expand and grow to include opioids. Even prescription pills a lot of times are what these kids are seeing in their residential environments.
One other thing that I want to touch on, as a school district, we work with Wright State University. Every other year we survey our 7th graders, 9th graders, and 12th graders to look for trends in drugs, alcohol. Most of our kids are doing the right things. They are living good, healthy lives. They're making good choices, but we really want to target those areas where our survey data says we need. Our partnership with the city, and specifically the police department and school resource officers, is just fantastic. Another example of collaboration, this summer we're hosting Operation Street Smart, which is a group from Columbus that comes down and teaches educators, law enforcement on all the new trends that are out there with alcohol and drugs. And so we're going to have about 200 people at that presentation. The adults continue to grow our knowledge so that we can continue to help kids. It's been a great partnership, and I think our kids and adults are learning a lot of information about this really important topic that's affecting our community.
My name is Jennifer Kane, and I'm a member of the Kettering Board of Education.
My name is Bill Lauder, and I'm a member of the Kettering City Council.
Partners for Healthy Youth began back in the early 2000s. The City of Kettering and Kettering City Schools recognized that youth and family in Kettering were facing some challenges unique to them. And so Partners for Healthy Youth was established so that the city and the schools could work together to address these issues facing families and youth in Kettering. Partners for Healthy Youth is comprised of a member of the Board of Education as well as a member of City Council, and the respective stakeholders within each of those organizations, folks like school counselors and youth program coordinators. We also have leaders within the business community and faith-based organizations, as well as medical professionals. As always, we are committed to prevention, and as Kettering faces the opioid crisis, Partners for Healthy Youth continues that commitment.
As a result, our Partners for Healthy Youth group put together a panel of community representatives. On the school side, we had administrators, we had counselors, we had nurses. From the city side, we had representatives from our fire department, from our police department, our planning department, and our parks and recreation department. This panel group talked about the issues they were facing and brainstormed how we could possibly deal with those issues. And the outcome from that process was the idea and the decision to look at creating a new position that would be jointly shared between the city and the Board of Education. And that position is a position called the Youth and Family Resource Coordinator. We want them obviously to be an advocate for the services that our youth and family need. We feel that this person will be a great resource for the children and families in the community, as well as provided necessary and needed support in dealing with this whole opioid issue that the community is facing. Well, this certainly is going to be a big job for the right person, Jennifer. Not only are they going to provide the support for children and families, but they're going to help address the opioid issue in our community.
Yeah. And Bill, Partners for Healthy Youth certainly is proud to be part of this endeavor.
And we're appreciative of the efforts of the Board of Education members. I know my fellow City Council members, and I think this is another example of how the two organizations, City Council and Board of Education, work together in the City of Kettering.
Yeah.
What can we do to stop this? And I don't know if there's an answer. At least I don't have an answer. Long-term treatment, education has got to be what starts. We have to start with our kids and say, you know that stuff in the medicine cabinet? It's not good for us. The aspirin or whatever, it's not good for us. And if parents realize that I don't use this prescription anymore, police departments have places that you can take your old drugs to. Get them out of the house, get them out of the availability, and then concentrate on letting folks know, as we're doing today, that this stuff is killing our community day in and day out.
So Narcan is a drug called naloxone. Narcan is the trade name, obviously, for it. We used to use much smaller doses than what we're using today because the drugs that we're seeing today are much more potent. The way that it works is Narcan releases the opiate off the receptors. The thing to know is that it isn't an instant fix. So there's a couple different ways that it can be given. If you're a regular community member, you're not with any medical or EMS, then the typical way you give it is intranasally. So you can get Narcan even without a prescription. You just go to the pharmacy and ask for it. However, you need to know that if you need it, you need to give some rescue breaths, get on the phone, call 911, because it can take 20 minutes for it to be fully effective. So if you see somebody who you're concerned about who's turning blue, not breathing, give the Narcan, do the rescue breaths, and call for help.
So now we have Narcan available. We saw where 1 or 2 administrations of Narcan save people. Now with the potency of the drugs on the street, we're seeing the administration of 10, 12, 14 kits of Narcan to save somebody. Why is that? Because we don't have heroin and we don't have just fentanyl. We have carfentanil and some of the other analogs of fentanyl that are, again, so incredibly potent that it's just killing people.
We've authorized our on-duty battalion chiefs and our crews to call for additional services so that we can even send more drug bags to an incident to have enough Narcan on scene to administer and revive these patients. We have increased the amount of Narcan in our drug bags from 4 from last year to 6 doses due to the increased use of fentanyl and carfentanil in the heroin. Narcan is available for those family members that feel that they have a family member using or abusing drugs through the Project Dawn program.
Sometimes addiction does start with prescription pain medications. It doesn't always start that way. The thing that we as a community just need to be cognizant of is that every prescription should have a good reason for it. If there's something that's needed for pain, we should be taking the lowest dose possible for the shortest period of time. Because beyond that, you're starting to develop what is called tolerance. And so now you need higher and higher doses, and you need more of that medication. And you know, that's unique to some medications. There are very safe medications that can be used for pain. We should be choosing those first. We've developed and used a program that we call Think Twice. It allows the provider to think through, what can I give this patient instead of opiates or something that's addictive in any way? And it gives them an alternative. So we've put it in a very nice visual format. How do we keep you safe? How do we keep the drugs out of your household so that your family is safe? And how do we get people to think through then the next step? If you are being seen at a physician's office and they're offering you this prescription, have you asked the right question? Is that going to be potentially addictive to me or anyone in my family? And are there alternatives? So thinking twice, that's what we're all about. Think twice, try to avoid those things that are addictive.
My name is Vicki Karaher. I'm the Senior Service Coordinator for the City of Kettering. One of the issues that I'm seeing because of the opioid epidemic is many of our seniors are very vulnerable. They have individuals who have access to their medication supplies, and the instances of abuse are very high. So those individuals may have access to their medicine cabinet. They may start out by taking 1 or 2 medications, and then eventually they start taking larger amounts. And that individual is unable to get more medications because those are very closely regulated. And the elderly person may be unable to get more medication and have severe decline in their ability to assist themselves and help. Plus, they also have that added fear that they have done something that would allow their loved one to become close to having a real issue with drugs. Over 3,000 people each day in the United States take prescription drugs that aren't their prescription drugs. And so there's a lot of guilt on the part of the senior that they feel like maybe it was their fault. So it's always a good thing for an individual to make sure you're locking up your medications. You can get medication lock boxes anywhere. Keep your drugs locked in those boxes. Store the boxes out of the way of an individual so they're not seen. Keep the key separate from the box or on the person. You want to protect yourself not only from people coming into your home, contractors or caregivers, but also make sure that your youth and some family members remove that temptation from them as well. Most individuals who have a problem with drug addiction started by stealing those medications from a loved one. So we need to protect our loved ones by keeping our medications locked and being a part of the solution and not the problem.
It's a really exciting project that Alcohol, Drug Addiction, and Mental Health Services has with Goodwill Easter Seals. And we've also partnered with Kroger pharmacies. So very soon these disposal kits are going to be available so that you can actually dispose of the rest of the opiates that you don't use.
The Kettering Police Department has also purchased a drug drop box. We know a lot of the problems are with family members who have opiates laying around from a surgery or other health concerns, that they don't use them all and then they're just laying around the house. And people always ask, what can they do to get rid of them? We will have a box in the lobby of the police department that you'll be able to show up and just discard those into the box, and then police officers will dispose of them properly.
People are taking these drugs or shooting up these drugs in all areas of our community. And we've seen them at fast food restaurants. We've seen them in the, quote, the Krogers, the Myers type stores. We've seen them in a parking lot. This is not a hidden problem. I think some people who actually take the opiates are looking for that ultimate high with the understanding that it's not my day to die. So my safety mechanism may very well be, I'm going to do it in a public place. I'm going to do it in a bathroom. I'm going to do it in a restaurant's bathroom. I'm going to do it in a parking lot. So if you see someone who is passed out, in a sense, behind the wheel, wherever, then notify your local law enforcement, because that person may be in jeopardy of dying due to a drug overdose. We used to worry about impaired drivers, and impaired drivers would be high on ethanol. They had too many beers, had whatever. Then we saw a shift, and we saw people driving under the influence of alcohol and some marijuana. We are seeing drivers now, 18 to 24, with fentanyl on board, with other opiates on board. And that to me is another sign of something that's coming down the pike, in a sense, where kids of a younger age are experimenting with stuff they shouldn't and are behind the wheels of our car.
From our crew's standpoint, we have seen the usage where we will have group parties where they administer and use the heroin product socially so that they can call for help for each other because they know of the dangers of heroin. Also, they're using them in public places in hopes that if they do overdose, someone will see them and call 911. And additionally, they're taking the heroin and driving around, and if they have an accident, they know that calls for service will be administered and that someone will call 911 to assist them. So if you see these type of incidents, do not hesitate. Call 911, call our Public Safety Dispatch Center, and call for help for these people.
We were asked quite a bit about signs, what people should look for in loved ones, indicators of they maybe have addictions or problems with narcotics. Some of the things that you should look for are changes in behavior, changes in friends or individuals who they run around with, people who sleep a lot, whose behavior becomes violent. Some of the signs that you should look for are needles that are around the house, spoons that are burnt, tinfoil that's placed in odd locations, or baggies, sometimes with the ends cut off. All these are some indicators, but not all. But if you have any questions and think that somebody is acting differently, you certainly can call the police department. You can get some advice from an officer, or any mental health field would certainly be more than happy to take your call and give you some advice on that as well.
The big challenge is getting people into treatment. We have some people who come in, I need treatment, I need you to help me, and we open our arms to them. But unfortunately, the vast majority really don't want anything to do with that. And the quicker they can get out of the emergency department, the better. That's just a sad thing. We need to continually work at them, family members, neighbors, and provide that kind of safe support system as best we can. But it is a challenge. It's very difficult.
If you need to call a professional like a counselor or a doctor, please do that. If you have a concern, address it immediately.
You know, there's actually a 24-hour number you can call in Montgomery County. It's crisis care. So if you suspect that somebody you love, a friend, a coworker, who's not showing up for work or whose behavior's changed, you know, if you find money disappearing, property disappearing, spoons disappearing, I mean, weird signs, you've got to call somebody soon and now. Don't wait.
That crisis care number is 224-4646. And if you call them, like Andrea said, they're 24/7. And you can find out resources, you can get an assessment from them. It's so important that you take action.
You know, and sadly, you're not alone in this. I mean, there's many of us. It's touching all socioeconomic levels, all geographical boundaries, all ages. If there's an emergency, do not hesitate to call 911. That is probably the most important thing. A lot of people are afraid of what's going to happen to them if they get involved, but somebody will die if you don't take action. So I really encourage you. Law enforcement and fire officials are working to make this a safe way for you to get somebody help. So it's very important to take action before it's too late.
Thank you for taking the time to learn more about the opioid and heroin epidemic that is impacting our Kettering neighborhoods and our families in such a devastating way.
In times of crisis, we, the Kettering community, always find a way to come together to support those in need. As you can tell from this program, the opioid and heroin epidemic is a crisis. It's time to do what Kettering always does. As individuals and as a community, we must face this epidemic head on. We are all in this together.